In today's news, Thai health officials give their assessment on the new COVID XE variant. International arrivals to Bangkok double after the easing of restrictions take effect, and police arrest another suspect in the drowned TV actress case. That's all coming up in today's program. You're watching Thailand News Today, bringing you the latest top stories in Thailand and beyond. My name is Jet Gunther, and in our first story, don't be alarmed, it ain't so bad. That's the gist of the message from the Public Health Ministry, which dismissed fears of the new XE variant's appearance in Thailand. As experts say, the symptoms are not as severe as previous strains of COVID-19. On Saturday, Ramathibodi Hospital revealed they've diagnosed the first patient with the new variant, saying that he has since already recovered. According to Dr. Supakit Sirilak, the Director General of the Department of Medical Sciences, the new XE variant is a combination of the two Omicron sublineages, BA.1 and .2. Further mutations to the virus are normal as cases rise, resulting in new variants such as Deltacron, which combines the mRNA from Delta and Omicron strains. And according to biotech expert Anand Jongkyaw Wattana, if you've already been infected with the Omicron BA.2 subvariant, then you may have some immunity to XE because of the genetic similarities of BA.1 and .2. Basically, don't be more afraid of XE than BA.2, as that strain has already been around town. On Saturday, the WHO has recognized the new XE variant, warning that it could be more transmissible than previous variants, though not more severe. They said there have been less than 600 confirmed cases since the variant was detected in January in England. Travelers are flocking back into Thailand after the country scrapped its pre-flight COVID PCR testing requirement. Arrivals to Suvarnabhumi International Airport have almost doubled to around 12,000 passengers per day, arriving on a flurry of new inbound flights. On Saturday afternoon, international travelers teemed throughout the airport, reaching near pre-pandemic levels. They were greeted by officials and hotel reps who shepherded them to their PCR testing sites upon arrival. Starting April 1st, international travelers entering via the Test and Go and the Sandbox schemes do not need a negative PCR test certificate issued within 72 hours of departure of their flight to Thailand. They are still required to take a PCR test on arrival and wait at an SHA Plus hotel until they receive a negative test result. They're also required to take a ATK self-test on day 5 and report it via the Thailand Pass app. Meanwhile, Thai PBS reported that PCR testing times have decreased, with results available within 4 hours of testing. This may eliminate the need for many travelers to stay overnight in a quarantine hotel, encouraging more tourists to enter the country. Quarantine for unvaccinated travelers has also been reduced from 10 days to 5 days, with a PCR test on day 4 or 5. Travelers must stay at approved alternative quarantine hotels. The mandatory stay for travelers entering Thailand through the Sandbox scheme has also been reduced from 7 to 5 days. It is also now possible to enter Thailand via land in Satun, Nong Khai, Udon Thani, and Songkhla provinces, or by sea at ports in Surat Thani, Phuket, and Chonburi. The rules have eased just in time for Songkran celebrations or Thai New Year, which will take place from April the 13th to the 15th.
Choose your trip to your favorite island with 5-Star Marine. Go to 5starmarinephuket.com.
Thai Prime Minister Prayut Chan-o-cha says he's concerned about the management of COVID-19 waste, such as used face masks and ATK test kits, because of the risks such contaminated trash poses to garbage handlers. Prayut says bags containing infectious waste should be clearly marked so binmen and waste disposal facility staff can take the necessary precautions when disposing of the rubbish. The Prime Minister asked the Ministry of Health to inform COVID patients undergoing home isolation to sort their rubbish and clearly mark bags of infectious waste that might contain ATK test kits, used face masks, tissues, bedding, or anything else which could carry bodily fluids. Marking the bags properly will allow garbage handlers to take the necessary precautions such as wearing full PPE. The PM has instructed responsible agencies to properly and efficiently dispose of waste which is possibly infected with COVID-19, while case numbers remain high across the nation. Director General of the Department of Health, Attapon Kyaosamrit, expects Thailand will produce an average of 789 tons of infectious waste per day in April, while waste disposal facilities nationwide can only handle 342 tons daily. The Department of Health is creating 11 additional waste disposal sites to handle the overload of infectious waste, with a capacity of 1,189 tons of waste per day. The total disposal capacity will rise to 1,532 tons per day, which should be enough to deal with the mountains of face masks and ATK test kits thrown out of Thai households this month. Police have arrested a third suspect in the death of drowned TV actress Tangmo. On Sunday, Wisapat Mano Mairat, known by the nickname of Sand, surrendered to police in Nonthaburi province after they issued a warrant for her arrest. Thai PBS reported that San was taken into the police superintendent's office for questioning. She was accompanied by her lawyer and prepared a surety to bail herself out. A crowd of reporters awaited her arrival, causing her vehicle to circle the parking lot several times before she got out and slipped quickly into the police station. She gave no comment when she left. Police say San was the last person who was with Tangmo on the speedboat when she fell into the river on the night of February 24th and drowned. San had earlier said Tangmo was holding her legs while she attempted to pee off the back of the boat when the vessel lurched and she shook her legs so as to not fall into the water with Tangmo. Police have since debunked the urinating story as a lie. Last month, they said the claims of the 5 witnesses had conflicting details and that all of them could be charged with giving false statements. Meanwhile, a Senate panel recommended the witnesses take polygraph tests. At the start of the investigation, police charged the boat owner and his friend with operating an unlicensed vessel and negligence leading to death. They now have also been charged with providing false statements and destruction of evidence. The investigation continues. Police have arrested a transgender woman who allegedly stole a gold necklace off the body of a Westerner in Bangkok's Asok neighborhood last week after a video of the incident went viral. The thief reportedly said she stole the golden accessory because she had lost her job and had to pay off a gambling debt. CCTV footage of the incident shows the 30-year-old trans thief pretending to hug the unsuspecting Western man while he was walking on the sidewalk along Sukhumvit Road. He did not notice her quick hands nimbly snatch the golden necklace from around his neck while he recorded a selfie video of the encounter. Later, when he realized his necklace had disappeared, he checked the video footage to find the thief. His self-filmed video titled Sukhumvit Road Gold Chain Ripoff, Be Careful of the Ladyboy Gangsters has gone viral on social media. Thai media reported that after the transgender woman stole the necklace, she took a taxi to the suburban province of Samut Prakan, south of Bangkok, where she said she sold it to a gold shop for 26,000 baht. Police officers checked CCTV cameras around the area and were able to find out where she lives. They then arrested her at a dormitory in the province. The suspect confessed that she did steal the necklace because she did not have a stable job and had debt from gambling. The police also shared that she had committed other crimes before, having been charged for theft, assault, and prostitution in Pattaya. And that is all for our report. Thailand News Today will be back tomorrow. Meanwhile, you're not up to date on the Thaiger.